The knee pain can arise from the knee joint itself, or it can be referred from elsewhere. So we will, first of all, we'll see the referred pains. It could come from the hip joint, it can have a referred hip pain, or it could be from the back. Now, coming to the knee joint itself, there are various reasons why you can get knee pain. It can be spontaneous, or it can be following an accident or trauma to the knee joint. So, if you classify into two groups, pain arising from the soft tissues of the knee joint and pain arising from the skeletal structure of the knee joint. The commonest cause of knee pain from soft tissues are meniscal tears, which can happen following a football injury or a twisting injury to the knee. You have like a joint line pain, and then it clicks, it locks, sometimes it gives way. That's one of the common causes of knee pain. Other causes of soft tissue injury pains can be inflammation of the patellar tendon, or the fat pad, or iliotibial band friction syndrome. These are the common soft tissue causes of knee pain. And for bony causes, it could be due to wear and tear in the knee joint. It's osteoarthritis or any other inflammatory arthropathy can cause knee pain. It depends on the cause of the knee pain. If it is a meniscal tear, it causes apart from pain, it causes clicking, give and locking. And if you have an ACL tear, you have initial pain and swelling. The swelling comes down in a week or two, then the knee becomes unstable, it gives away. And for osteoarthritis, you have a dull, achy kind of pain. There will be a lot of stiffness in the knee joint, and as the days goes by, towards the bedtime, the pain can be slightly worse, but with activity, the pain normally gets better in osteoarthritis. So it actually depends on the cause of your knee pain. So if it is a meniscal tear, if it's an acute meniscal tear with a bucket hand displaced tear, we can do an arthroscopic repair of the meniscal tear. So if the meniscal tear is due to degenerative changes, we can manage without surgery with physiotherapy. And if there are mechanical symptoms associated with the meniscal tear which is not responding to conservative measures like physiotherapy, then you may need a keyhole surgery to trim the unstable portion of the meniscus. And if it is an ACL rupture causing instability to the knee joint, if somebody is very active playing football, things like that, then I would normally recommend surgery, reconstruction of the ACL. If the knee is not depending on ACL, then it may be possible to manage without ACL reconstruction. For arthritic knee pain, initial management is always conservative with physiotherapy, painkillers, and exercises. But once it has progressed to a certain level, causing significant difficulties, then we can do arthroplasty. Now, in middle-aged group with active people, you can have limb salvage procedure like a high tibial osteotomy, which you are maintaining your joint but taking away the pain and difficulties associated with it. These are some options which are available for the knee pain. Usually, as with any surgery, whenever you cut the skin, there is a common complication of infection or blood clots. The things that are specific to knee surgery are you can get stiffness in the knee joint, especially if you don't follow the instructions from the physio and do the exercises. There are risks of causing nerve or vessel damage in joint replacement. There's a risk of fractures to the bone, which are very rare, nerve vessel damage, and the infection can happen. Again, we take all precautions, but there is a small chance of infection. And the lifespan of the implant is about 15-20 years, then it can wear out, we may have to redo it. As far as the ACL is concerned, it's very important that you follow the instructions with the physio. Don't do contact sports until we advise to do so. Or we can have re-ruptures and things like that. Again, in ACL reconstruction surgery, you can have infection, blood clot, stiffness, scar formation, and things like that. It depends on what kind of surgery you're having. If it is a simple arthroscopy with a meniscal trimming, you are quite good at 3 to 4 weeks' time. In 2 weeks' time, it will be painful. If you're having ACL reconstruction, it's a bit more invasive surgery. It will be painful and swollen for about 4 to 6 weeks. Then it'll get easier. Then you have progression of physio and exercises. For arthroplasty, knee replacement is quite a painful surgery, unfortunately. It'll take about 6 weeks for the initial pain to settle down. Then the knee will remain swollen and a bit sore for a few more months. In about 3 months' time, it's pretty good. And the knee will keep on improving up to 18 months after surgery. For high tibial osteotomies, again, it's a bit painful surgery. You'll need crutches for first few weeks, about 6 weeks, and then we start weight bearing. In 3 months, you're pretty good. For meniscal repair, bit more complicated rehab. You need a knee brace for 6 weeks. We'll be on crutches. Then we take the brace off. Then we have further physio, and then keep improving.